Hi, good evening. Welcome to the LBJ School of Public Affairs. We are the Feminist Policy Alliance, and we are excited to bring this panel discussion to you with our co-sponsor, the Texas Observer. Tonight we have three panelists: State Representative Jessica Farrar, Heather Busby, and Jessica Luther. State Representative Jessica Farrar represents District 148 from Houston. She has served with the Texas House of Representatives since 1994 and is the Vice Chair for the Judiciary and Civil Jurisprudence Committees, as well as a member of the State Affairs Committee. During the summer's special session, she played a critical role as one of the most outspoken opponents of House Bill 2. Representative Farrar's questioning Representative Farrar's questioning during the State Affairs Committee hearing exposed the ignorance of the bill's author and proponents, as well as the legislation's true intentions. Serving as both the people's champion and cheerleader, she fought to delay House Bill 16 and House Bill 60, and to remind the public that our presence mattered and our voices were heard. Heather Busby is a Texas attorney and the current executive director of NARAL Pro-Choice Texas. In the past, she worked for the Travis County Attorney's Office on behalf of survivors of domestic violence, wrote for RH Reality Check, and co-founded the Lilith Fund, a group which provides financial assistance to those in Texas who cannot afford abortion services. Heather engaged the Texas community to voice opposition against the omnibus abortion legislation and served as a key volunteer coordinator through NARAL. Jessica Luther is a historian, accomplished writer, editor, and one of the most important community activists of the special session. Her published works on reproductive justice and politics have been featured in The Atlantic, The Guardian, and Ms. Magazine. Opponents of House Bill 2 look to Jessica for up-to-the-minute coverage and guidance for increasing the movement's social media presence. Before we begin, I'd like to welcome and introduce our moderator, Dave Mann, editor of the Texas Observer.
Okay, I want to thank you all for coming. I'm going to try to project, so if you can't hear me, just raise your hand or wave your arms or go like this, and I'll try to project. I want to thank you all for coming and thank our panelists. I think we'll have a really interesting discussion tonight. I also want to thank the LBJ School for co-hosting this event with us. Before we get started, I just have two items of housekeeping. The first one is that we have a Texas Observer table out front, which you pass on your way in, with t-shirts and bumper stickers and all kinds of cool stuff. The t-shirts are newly designed. In my completely objective opinion, I think they look great. So we've got that out there, and we're also going to be passing around a email sign-up list if you want to get on our email list. We won't overload your inbox. We send one email a week. You get updates on our big stories. You get information on events like this one. And you get some special offers on subscriptions and sponsorships and things like that. So that'll be coming around. The format we're going to go through tonight is we're going to have a discussion for 35-40 minutes, and we'll open it up for our audience question and answer, and kind of go from there. I'm hoping we'll have some good back and forth. And before we kind of get started with the panel, I thought I'd just go for a couple of minutes and give a little bit of background. I'm sure most of you know very well about what happened over the summer. And it's interesting, although I was watching it so closely, I went back and reviewed what happened. I'd forgotten that, the special session that was called, the first one, wasn't about abortion at all. It was about redistricting. That's why the legislature came back into special session over the summer. And in fact, there had been plenty of anti-abortion bills during the regular session, and most of them really had gone nowhere. And in fact, a lot of people were calling the regular session the kumbaya session, because there had been so little controversy, especially compared to what we saw in 2011. And in fact, from a journalist perspective, we were kind of rooting for a little bit more controversy at times. And then we learned that old saying, be careful what you wish for. In the first special session, the abortion didn't get put on the call until very late. And of course, as you all know, that engendered this incredible backlash with hundreds and hundreds of people testifying in committee hearings and lengthy debates in the Texas House, and of course culminating at the end of the special session with the incredible day in the Texas Senate. Have you guys heard of this person, Wendy Davis? There's been a news story or two about her, I think. I think it's not an overstatement to say that was one of the most amazing days and nights that anyone following Texas politics really had ever seen. The 11-hour filibuster, the manipulation of the rules by the Senate leadership, the attempts to shut down the filibuster, and then of course the last 10-15 minutes when the Senate literally got shouted down when they tried to pass the bill. And then of course Governor Perry calls another special session, at which point the kind of sheer numbers and the huge Republican majorities that are in the legislature really took over, and there really wasn't a lot that opponents of the bill could do, and eventually the bill passed, but not before more lengthy and contentious committee hearings and debate on the House floor, and then culminating in the Senate, where we had state troopers confiscating tampons from women entering the Senate gallery, which became known, of course, as Tampon Gate. And then, of course, the bizarre story of state troopers supposedly confiscating 18 jars of suspected, keyword, feces, and a jar of suspected urine, which became known as Poop Gate. I guess Feces Gate just didn't have the right ring to it. I don't know how these things get named. But, and DPS, despite numerous requests, has yet to offer any concrete evidence that these jars actually existed. And while it's kind of a funny story, I think there is an underlying issue there, which is, did the Department of Public Safety, the top law enforcement agency here, manufacture this story for political purposes, or do those things actually exist, or was it a communications mix-up? We haven't really gotten the full answer on that, despite numerous media requests. So the bill passed. Governor Perry signed it into law. We are now going through the process of DSHS is implementing it. The provisions of the bill. It bans abortions after 20 weeks based on the idea that the fetus can feel pain after 20 weeks, the theory, I should say, that that's the case. I believe the limit had been 26 weeks of gestation, is that correct? Before that bill was passed? 25? A second main provision was requiring abortion clinics to comply with regulations for ambulatory surgical centers, which are pages and pages of regulations on building specifications, the width of hallways, staffing, regulations that I believe only a handful of abortion clinics in the state can currently comply with. And the reason for this that was offered for those regulations being imposed was making abortion safer. And of course the criticism is that, well, this is a backdoor way to try to close many, many abortion clinics. Third main provision is that abortion doctors in Texas would have to gain admitting privileges in hospitals within 30 miles. And a fourth one is stricter guidelines for how abortion doctors could prescribe abortion-inducing medication, RU-486. So that's the background, which I'm sure many of you know very well and have been following this very closely. So we have a bunch of topics to get to. I just want to start with the panel, we kind of go down the line here. I kind of start, I want to focus on going forward, looking at what the implications, practical implications of the bill might be. Let's say all those provisions are in place. What kind of implications are we looking at for access to abortion in Texas?
Can y'all hear me? Am I loud enough? Yeah. Excellent. So I think, the most obvious thing is that we will lose clinics, and access, which is already not great in this state, is going to get much worse. And the effect is going to be felt by the women seeking abortion. Just to give you an idea, as introduced, I was co-founded the Lilith Fund, which is an abortion access fund. We help women access abortion when they can't afford it. In 2012, Lilith Fund received 3,443 calls to their hotline, and they were able to fund 1,214 of those callers. So a third of the need they were able to meet. So you still have...
And Lilith Fund only covers half of the state, right?
Right.
Maybe a little bit more than half of Texas. So that's only the numbers with that.
Yeah. And Texas Equal Access Fund, which covers North Texas, has comparable rates of the number of women that they're able to assist. And this is pre-HB2. And we saw after 2011, when the sonogram bill went into effect, how the demand on the hotline was already increasing, and now we just expect that those numbers are going to keep moving down. We know that the sonogram bill studies have been done that show that it is impacting women's access. They're seeing out-of-pocket costs, in addition to the cost of the abortion, an average of $141. Women are traveling on average 43 miles, sometimes up to 400 miles to access a clinic. You're looking at having clinics shut down, in the Valley, in El Paso, in West Texas, in East Texas, and if we end up with clinics only in Dallas, Fort Worth, Austin, Houston, and San Antonio, that's only a small piece of the state. We've got a huge state, and there's a lot of women who are going to be struggling to access these services.
I'd only add that you have to look at this in the larger context. Look at the family planning dollars that were cut, and then particularly the largest provider is Planned Parenthood, and they provided over half of the services to women. And so by cutting them out, you've cut out more than half of the providers. So that the infrastructure of providers has not recovered, and so you're going to see more women having unwanted pregnancies because they're not able to seek family planning services.
Yeah, so the clinics that are going to be shut down, it's not like they only do abortion. And so that's another, we're talking reproductive health generally is going to be damaged by this bill. And I think the only other thing I would want to add is sort of pointing to the RU 486, the abortion pill, all the regulations on that, and the impact that will have specifically on women who live in rural Texas, which is most of Texas. Most people live in urban spaces, but there's a huge swath of the state where making it harder to take an abortion pill it just seems so sinister. And on top of that, I think Heather, maybe yesterday, maybe you mentioned it, the abortion pill we think about women who are in a situation where they may be facing domestic violence or some kind of abusive situation, and what that pill can offer them that would be much harder for them to manage if they had to go do a surgical abortion, right? So we're talking about the most vulnerable people, and we're talking about not just access to abortion, but also a larger access to reproductive health care.